So now what we have is our end result, where we finished our Roman sandling. I've basically tied it to the tube 4 separate times along the length, just repeating that technique I was showing before. And while, again, we've made little divots in the tube where the suture sits, we haven't completely cut off the inside of the tube, so we can still drain or inject things. And you can always check. You can always use a syringe at the end and flush the tube, and that's a good practice to have. But because of the technique we've done, now it's secure to the skin of our patient here, and then we have multiple points where it's actually attached to the tube, so it's very difficult to actually slide this. So we can't actually slide this tube through the sutures that we've tied, which is the whole point. Now this should keep this tube in place, and really for this tube to be pulled out of the patient, this suture would have to break on the bottom. So in the end, we have our desired result. And again, I just want to reinforce, if you have a patient that you're particularly concerned about, maybe pulling out their tube or their tube falling out, you can continue this Roman sandal tying pattern all the way up until you literally run out of suture. And again, you can throw a second suture to the patient and anchor it to another point on the skin. So there's a few other things you can do, but this is just a basic start, and I think a good example of a tube that's going to be pretty secure in place.